we will like to see and to discuss a little bit about the priorities in research and action gaps to actually try and implement these connections at a large scale, or better saying, perhaps, to implement our sectorial programs in a way that these connections are made in very strong ways, and in the way that the connections are made, creating the best synergies. So to do that, we have here with us 4 outstanding presenters that will provide their insights from very different angles. As you know, you are very familiar now with the dynamics of the plenary sessions, so you have their bios, so I'm not going to spend time with the long introductions of themselves. But before I actually ask them to provide their insights, I just wanted to make a common question to all of you, the 4 of you. I want to ask you one thing. We have been hearing repeatedly here several times, we have several people, that the best connector maker is that woman, that is the rural woman, that is a smallholder farmer, a mother of 3 or 2 small children. She is also a healthcare provider, a social care provider for their elderly and for their family. And so I first would like to ask Rob Bertram from the new Bureau of Food Security of USAID. How do you think that then research can help addressing the need for integrating actions at service delivery level so as we reach that woman with a more integrated approach?
Thank you, Denise, and good afternoon, everyone. I wanted to start this afternoon by noting that fundamentally agriculture is about food. And when I say that, I mean development investment in agriculture. As much as agriculture drives poverty reduction, there was almost no investment in agriculture by the development community for many years until the 2008 food price crisis and the spikes in food prices once again put agriculture front and center on the development agenda. Hunger is something we can all see as absolute, whereas poverty is a lot more relative. And I say that, I'm saying that in a sophisticated audience like this, we know how important poverty is. But I think when we look at what really drives investment in the sector, it's hunger, it's lack of food. And I think food is the common ground for the agriculture and the nutritional communities, and I think much more so nowadays, the health community as well. And it's interesting to note that in Feed the Future, our success will be measured by reductions in poverty and reductions in child stunting. So we have a common indicator that cuts across our communities. So thinking about what agriculture can do for nutrition, to start with, agriculture is a business, but what we're all about here this week is turning profitability and productivity gains into nutritional and health outcome gains. So some ideas on research first. I would say one thing is to boost grain legume productivity. There are many good reasons to grow grain legumes around incomes and sustainability, but frankly the fact that grain legumes have become so expensive relative to cereals has a real impact on iron deficiency anemia among the poor, especially women, Denise, and children. I think we need to pursue a research and a development agenda on diversification of cereal-based systems with grain legumes, vegetables, horticulture crops, oil seeds. These are all driven actually by income, but the nutritional outcomes and the health outcomes that we can derive from these I think can be extensive. And this is an area where we need the help of the nutrition and health communities, because you are the experts at social marketing, at behavioral change, and other factors that we as agriculturalists need. Diversification of those systems does not mean ignoring the cereal staples like wheat and rice. In fact, productivity gains in those staples have very high caloric elasticities for the undernourished, but they also are key signals of food security for poor people, and they potentiate diversification into these other higher income commodities. So we can't ignore the cereals and just focus on the other crops. It has to be the whole package. I think we need more research on evidence around the impact of vegetables on nutrition and health. It's quite robust, I think, in terms of gender and incomes. I don't think it's quite as clear with respect to nutritional outcomes. And even the homestead gardens that we've heard about this week, really the success often depends on the insertion of small livestock and poultry. Animal source foods, dairy, poultry, eggs, fish, and meat, critical to human nutrition and especially to child development. We didn't hear enough about them this week, in my opinion. They're critical for incomes too, and for women's access to incomes. And I think this is a place where I really want to caution that we be careful about projecting developing country attitudes onto poorer people in poor countries. The overconsumption of animal foods in countries where most people rarely get meat, eggs, fish, or dairy we shouldn't equate the two at all. They're very distinct, and of course one of the great outcomes we'd like to see would be children actually having access to these foods. In health, I think there's a clear research agenda around the enlightened use of agrochemicals. We already recommend no pesticides be used in rice production. So that's a big gain over 25 years ago. And that's based on the science of genetics and the science of ecology. Food safety, obviously a lot to be done around zoonoses, safe handling of perishable foods, and food contamination and aflatoxin. But it was hard to see the development agenda, and I frankly was a little bit concerned that in the sessions I was in, the food safety in terms of overseas exports was clear, but the food safety being attained in the local and regional markets seemed to be missing. The markets still are not demanding it. Somehow that has to happen if we're serious about food safety. So a little bit on how, and I know I'm out of time, so I'll be quick. There was a clear message to break down the walls. How about some ways to do that? One, I really liked the idea of multi-sectoral training, agriculture, health, and nutrition. And that actually matches food security, which encompasses availability, access, utilization, and safety. I think USAID and other development agencies could foster this both internally but also through our external partnerships. Also, co-location of programs of nutrition, health, and agriculture programs would help, as would shared indicators. Devising a common language would help. I think we're closer in nutrition than we are with health between the two, with agriculture, but that we could work on that. And I think investing in impact assessment that includes the analysis of the pathways and relationships in generating nutrition and health outcomes and giving us really robust evidence would be a great step forward, and many people have cited this week. Finally, I'd just like to share a couple of concerns with you. As I said earlier, I'm concerned about placing our developed country lens on the problems of the poor in the developing world. I mentioned this about animal source foods. I also will mention it about equating undernutrition with chronic diseases. From a development investment standpoint, the problems of a poor choice of foods versus the problem of not enough food or no choice of foods for a good diet are not the same. They don't represent the same development imperative, and in my opinion, they're not morally equivalent. I think we also have to keep the focus on those who, without enough food and without access to higher quality foods for a better diet. And finally, with all due respect to the fact that wealthy people have a preference for organic foods in many situations, I don't think there's any evidence to suggest that these are nutritionally or either nutritionally better or more healthy. And I would be very concerned if we were to look at poor farmers in developing countries where we desperately need them to use mineral fertilizers and to start to project an organic food approach on that. And nobody's really advocating that, but it's just to not be distracted by the fact that what we like in North America or Western Europe isn't necessarily what poor people and poor women need in the developing world. Thank you.
Thank you very much, Rob. Now, Rob Boss from the World Health Organization. We just heard that agriculture is closer to nutrition than to health research. So what's your view on this, and how can the Global Forum for Health Research help making this bridges?
Thanks very much, Denise, and good afternoon. I think I would like to start with a little preamble on that, because we've heard a lot about agriculture and nutrition this week, or these days, and it looks like a week. Often the health part then became like a function of the nutritional part. And I would like to remind the audience that, of course, agriculture health linkages have a much broader scope, which we shouldn't neglect. Other than the agriculture, nutrition, and health link, there are other disease issues, communicable diseases such as malaria and schisto, related to irrigation, diarrheal diseases related to wastewater use in agriculture, the zoonosis and livestock story, HIV/AIDS in seasonable labor movement, and then, of course, non-communicable diseases, toxic chemicals, poisoning, and cancers, but also less heard of issues of mechanization and injuries and accidents, and let's not forget the mental health status of farmers. In many parts of the world, there's a high level of suicide among farmer communities, and that's a very important public health issue. Now, I have a number of issues, and I hope that in my remaining time I can go through those. The first one is that we've been talking a lot about intersectoral action and breaking down the silos. But actually, these are statements that have been made the last 30 years or so, and that keep coming back. But we don't really know about the nature and opportunities of intersectoral action a lot. Yesterday, the statement was made that we have to think intersectorally but act sectorally. I think that would be a big shame, because we lose out on a lot of opportunities that way. But shouldn't we really do some solid research, sociological research, on what the nature is of governance mechanisms, how intersectoral action fits in that, and why it's so difficult to achieve it? And then we get some of the evidence and answers. Similarly, people have been saying, yes, we have to get people trained so they can operate multidisciplinarily and intersectorally. And again, that's very easily said, but how do you actually train people for that? What sort of programs do you have to set up? It's not only the people that now are the coming generation, there's also, of course, the current professionals that are working. And there are possibilities like problem-based learning approaches that can help adult learning and get these people to actually get the skills and the capacity to work more intersectorally. And of course, we shouldn't forget that with training, there's always the issue of career structures. And in fact, I would claim that silos that we're working in are structures that help us support in our career as they're perceived nowadays. And we should therefore see, if we break down those silos, what do we do about career opportunities and career pathways? Research on communication, I think, is a very important thing, because outcomes of multidisciplinary research need to be channeled to the right people. And I know from the experience we had with our interdisciplinary research at Warda on malaria and rice cultivation, that all the papers ended up in a medical journal, which was never read by the agricultural policymakers that the outcomes were intended for. So we have to look at that. We have to find out also through research how we can get information from this woman farmer that Denise was talking about her needs, and also when we work on her needs, how we then communicate back to her what the findings of our relevant research are. Do we want to use agricultural extension workers to bring out health messages, or do we want to get community health workers bring out agricultural messages? How do we go about that? Then integration of delivery of interventions at the household level is an area that needs more research. Fadi Doumani at the World Bank and Jim Listorti about 10 years ago already said that 40% of the burden of infectious diseases could be reduced in low-income countries by 3 interventions: household water treatment, giving people stoves to reduce indoor air pollution, and giving them mosquito nets. And of course, if we can better get the evidence base for that and link that also to nutrition, which would be another enhancing factor, we would be much further in our approaches. Now, the global framework that, for instance, was produced by Mr. Hodinot on the first day makes things look globally very complicated. There are so many aspects and so many linkages and so many pathways that it becomes rather daunting to think of solutions. So I think for research, real on-the-ground research approaches, we have to start thinking more in scenarios. And one example, which I already mentioned, is the whole issue of urban wastewater reuse for agriculture. It brings together all these elements that we're talking together but in a workable situation. It's about farmer communities, their livelihood, their nutritional status. It's about food safety for urban populations. And it is about using scarce resources in an optimal way, both water and the nutrients that come with wastewater. I think the two other issues that I want to raise, one is economic research. I mean, if we want to have sectors talk to each other and we haven't yet got the people that have been trained enough to do that, then maybe economics is our common language. And so if we can get the economic aspects of food production linked to the economic indicators that we've developed in the health sector to talk about burden of disease and health impacts, then we would come a long way. And of course, the whole point of investment planning and how you can mainstream certain health issues and particularly health safeguards into that is another issue, and that links up to health impact assessment as well. And that also links to the possible points of interaction between the agricultural value chain and the chain along which we deal with health risk assessment and health risk management. These are new concepts, both on one side in the agriculture sector and on the other side in the health sector. And these meeting points, these flash points in the two chains should be investigated through research to see how we can have them enhance each other optimally. And finally, in the context of climate change, which of course is the thing that sort of concerns us all, if we could apply climate change scenarios to options for adaptation of agricultural practice and infrastructure, and then screen those options also at the same time for the health and nutrition opportunities, we would really probably have a very good framework in which to operate for that. Thanks.